This is Dr. Tahmidar, member of Scientific Board of Medical School of Sheikh Bershi Medical Sciences University. In this session, we are going to talk about the worms. As you know, worms divided in two parts, the flat worm and the round worm. The flat worm also divided in two parts, cystos and trematodes. And in this session, we are going to talk about the trematodes, which are very important for us. The most important character which help us to recognize trematodes from the other worms is two sucker. One of them is oral sucker and the second is ventral sucker. In this slide, we are going to talk about the classification of trematodes or fluke worms. They are included in the phylum of Platanectes. The phylum of Platanectes has two classes, trematodes and cystos. And the trematodes has two subclasses, monogena and digena. Monogena usually are the parasite of reptile and amphibians, but the digena are the parasite of human and cattle and some other vertebrata. In the next slide, we are talking about digena. Digena have two hosts. The first one is intermediate host, which usually is a mollusca, which live in fresh water or brackish water. And the final host usually is a vertebrata, and human accidentally can be infected with these worms. The morphology of trematodes is very important because I told you before that they are fluke worms or leaf-like worms. In this picture, you can see the oral sucker and ventral sucker on the surface of a trematode. Besides that, all over the body of the trematodes covered by integument, and you can see buds or tubercles on integument. Of course, in the next picture, you can see the schistosoma. As you told you, the trematodes are fluke-like forms, but the schistosoma is a little bit more different because they are adapted to live in blood vessels and they look like the nematodes or roundworm. For being more familiar with dermatodes, it's necessary that we talk about their biological system. The first one is digestive system in dermatodes. As you can see in the anterior part, we have an oral sucker, which is located around the mouth. After that, we have the pharynx, and after that, we have the esophagus. And esophagus divided to two intestines, and these intestines continue until the end of the body, but they do not have any anus. So we call them the second. The nervous system of trematode consists of two lateral ganglions around the pharynx that connect to each other by nerve tracts. Each ganglion sends some nerves to anterior and posterior part of the bone, and these nerves connect to each other by phenomenal nervous tract. The excretory system of dermatodes consists of phlegm cells. These phlegm cells are located in all over the body of the dermatode and collecting bad material and transfer them to tubes, which these tubes connected to bladder, and the bladder will be connected to excretory pore. In the right picture, we can see one alone flame cell. In the anterior part, you can see the nucleus, and under the nucleus, you can see the flames. You can see the cilia. These cilia are moving all the time, look like the flame of fire, and collecting the bad material and transfer them to excretory canal. Male reproductive system of dermatodes consists of two testicles. These testicles sometimes dendritic or sometimes lobular. From every one of the testicles, we have was efferent, two was efferent, meet each other and making was different. and was different continue to seminal vesicle, the place that collecting the spermatozoid. And after that, they continued to serum, which located in serous sac, and the serous sac is located in genital pore or genital atrium. In the right picture, you can see the more magnification of male reproductive system. In posterior part, you can see two testicles, and was efferent, was different, and they are continuing to seminal vesicle. And over the seminal vesicle, you can see the prostate gland, and after that, you have the serous sac, and the serous is located in serous sac, and all of them located in genital atrium. Of course, in the right part, you can see the uterus, that there are a lot of eggs in uterus, which is continued and finished, ended to genital atrium. In this slide, we are going to talk about the female reproductive system. As you can see in the left picture, there is an ovary or dendritic ovary, and from the ovary we have the oviduct, which transfer the ovule to a crossroad, which name it ootype. Of course, inside of the worm, you can see the vitelline gland, which they transfer vitelline from the vitelline duct to ootype, and after that, the eggs covered by the shell, they transfer to uterus. In the right picture, you can see a more magnification of the female reproductive system. In posterior part, you can see the ovary, and after that, you can see the oviduct, and in the right, above the ovary, we have the seminal receptacle, and the spermatozoid are saved in this place. Whenever that one ovule released from the ovary, when it's passing in front of the seminal receptacle, some spermatozoids are released and to mate it and make it a new generation for making an egg. Of course, you can see Mehlis gland around ootype, which they produce the shell of the eggs, and of course, two vitelline duct, which transfer the vitellaria for completing the structure of eggs. And after that, the eggs were completed, they transferred to uterus. In this slide, we are going to talk about the life cycle of teratomes. Of course, non-schistosoma life cycle variation. It means that the schistosoma life cycle is a little bit different from the other teratomes. As you can see, this slide divided into parts. One part is green, and we name it asexual generation, and the part with red color, which we call it sexual generation. We started from the first flash of sexual generation. If you can see the cercaria, which insists on the water plant, and they change to metacercaria, can be eaten by human or other vertebrate. Partially mature adults emerge from cyst and mature. After maturation, they will release the eggs, and eggs with feces will be released out. After that, the eggs released, there is two ways. One way, egg eaten by a snail, feeding on feces, then hatch into miracidial larvae, and the second way is eggs hatch into miracidial larvae which seek out snail host. After that, they will find the miracidium, of course, larvae produce mother spore cyst in the body of the snail. After that, we can see two ways. One of them change the miracidia to mother spore cyst, and after sometimes produce daughter radia, and the radia produce more radia. And the second way, miracidium change to mother spore cyst and produce many daughter spore cysts. But the results are the same. It means that after these two ways, we have the cercaria or daughter spore cyst or radia produce cercaria larvae. And these cercaria will go to the plant water and insist on them, which we call them the metacercaria. And the life cycle will be continued. The pathology of dermatodes are depending on the place of the resident. Some dermatodes, like Bacillopsis buscae, which they are resident in intestine, making some problem in intestine by their oral sucker and ventral sucker. The place of attaching the worm to the intestine, there would be some lesion and perhaps making some bleeding. The next trematode, which they are living in the liver, making some problem for obstruction of bile duct and perhaps the carcinoma of liver or cirrhosis of the liver. The schistosoma, which they are living in blood vessel, making some problem for blocking the blood vessel and making the cirrhosis. And the trematode which they are living in the lung, like Paragonus festemari, making hemoptysis and coughing and chest pain for the host or for the patient. How about the immune system of human against dermatodes? As you know, human immune system can manage the dermatodes infection by humoral and cellular system. But the schistosoma evade from immune system by shedding. In this slide, we are talking about the scientific classification of dermatodes. As you can see, the kingdom of Animalia, the phylum of Platyrhinidae, and the class of Dermatoda, subclass Diagena, or their Echinostomidae, the family Fasciolidae, the genus Fasciola, and the species is Hepatica. The first worm which we are talking about is Fasciola hepatica. As you can see the picture of the fasciola, you can recognize that it's very look like the leaf of the plant. In the left side, you can see the cephalic cone, which we can see the oral sucker on it, and after that the genital pore, and interior part, you can see the ventral sucker. Of course, you can see a lot of branches in the body, some of them the branches of testicle, and the other is the branches of vitelline gland. The geographical distribution of Fasciola hepatica is very important because it is found in rural areas of temperate and tropical region, especially located in regions with cattle and sheep herding. WHO reported that found on every continent with nearly 180 million people at risk and an estimated 2.4 million people already infected worldwide. and how it can be transmitted to human or the animals. Transmission occurs through the ingestion of raw, fresh water and vegetation. Plants become exposed to the metacercaria, and when the body of water that the vegetation is growing in become contaminated by eggs in the fecal matter of the infected host. An infected form of infection known as hallucin. Of course, it is popular in Middle East because they contracted by eating the lower liver of an infected animal. The morphology of this worm is very important. The adult has a flat leaf-like body. The size is about 20 to 30 millimeter long by 8 to 15 millimeter wide. It has an anterior elongation, which we call it cephalic cone, with oral and ventral sucker, which are located in the body. Intestines are very branched. The next important thing about Fasciole hepatica is its eggs. The egg length is about 120 to 130 micron length, and width is 85 to 8 micron. Of course, it has opercle, and this opercle, after that, the eggs were released and floated in the water. After some days, the opercle will be open and the mycelium will release. The important host of this worm is cattle, sheep, and sometimes human. In this slide, we are going to show a schematic life cycle of Fasciole hepatica. As you can see, the final host is a sheep which infected to this worm in liver, and the eggs of the worm are released in the bile duct and transferred to intestine, and the eggs released with feces in environment. After some times in the water, the eggs will be hatched, and after that, the mycelium penetrate in the mollusca body, and it will change to a sporocyst, the mother sporocyst, and after that, redia, and more redia, and finally, the cercaria were released. These cercaria released in the water, and they swim to go near the water plant, and after some time, they will be changed to metacercaria. In this slide, we continue the life cycle in more details. As we told you, the adult form of Fascicular hepatica lives in the bile duct of the host liver. After 2 to 4 months, the eggs will be produced and the eggs pass down the bile duct through gastrointestinal tract and are released in the host feces. Of course, it is necessary the water of temperature above 10 centigrade to hatch. The egg hatches and release basidia. These newly hatched basidia must find a limna snail host within 24 hours of hatching or they will die. As we mentioned before, inside the limna, Basidium loses its cilia and develops into a sporocyst. Each sporocyst develops into a redia, which then bears the sporocyst and migrate to the hepatopancreas of the snail. Redia then develop into cercaria. The cercaria attach to plant matter and insist forming metacercaria, which is the infective form of the fluke. Mammalian host consumes the vegetation with the metacercaria, which then exists in the small intestine. And of course, human is accidental host for this form. After that, the metacercaria was ingested. It will burrow through the intestinal wall, move through the peritoneal cavity, and enter the liver parenchyma. Immature flukes migrate through the liver parenchyma for 6 to 8 weeks, giving rise to acute symptoms. Once mature, they settle in the bile ducts and begin to produce their own eggs after about 1 month. In this picture, you can see some adult Fascicular hepatica in the liver. Of course, here you can see the 1, 2, and 3 Fascicular hepatica in this picture. In this slide, of course, the flesh show you the place of Fascicular hepatica, which also they are in the parenchyma of the liver. In this picture, we are going to show more specifically the place of organelles in the fascia hepatica. If you take a look at the right picture, you can see the oral sucker, ventral sucker, the place of uterus, and the cecum, the ovule, the ovary, and the testicles, to dendritic testicle, which is located in two-third part of the body. And of course, you can see the vitelline gland side by side of internal the worms. In the left picture, you can see two eggs. These eggs opercle are opened and the miracidia are released. Slides, we talk about the host of these worms. We told you that these are from Diagonal, and they have two hosts. The first one is intermediate host, and the second and the final host. Intermediate host of this worm is a snail, especially 21 species of limne, and especially limne truncatula is the most important intermediate host for fascia hepatica. And you can see the picture of the shell of this snake. The final host is sheep, cattle, rabbit, and other mammals. After that, people infected to this worm, they have four symptomatic patterns. The first one is acute phase, the second is chronic phase, the third is hallucin, and the fourth is ectopic infection. And we will talk about this phase in the other slide. The first phase is acute phase. Of course, it is rarely seen in human, but it happens. You can see the fever, tender hepatomegaly, and abdominal pain, which are frequent symptoms. Vomiting, diarrhea, and anemia may also be present. The second phase is chronic phase. It's more common in human population. Symptoms include biliary colic, abdominal pain, tender hepatomegaly, and jaundice. But all this happen in adult human. But in children, it is a little bit more different. Usually, the children which is infected with this form, they show severe anemia, which is common in children. Inflammation of the bile duct eventually leads to fibrosis and a condition called Parkinson liver. Severe infection can lead to death. So we have to be careful about the children. last phase is hallucin and ectopic infection. Hallucin when an individual consumes infected raw liver. In Middle East, sometimes people or adults eating the infected raw liver. The adult forms can cause considerable pain, edema, and bleeding that can interfere with respiration. Adults can live in biliary ducts and cause symptoms for up to 10 years. Infrequent, but can occur in peritoneal cavity, intestinal wall, lungs, subcutaneous tissue, and very rarely in other locations, which we can see the ectopic infection of Fasciula hepatica. Epidemiology about this worm reported animal infection from all livestock producer countries from all over the world. Human infection from north of Iran, Cuba, Great Britain, south of France, and Algeria. And how about the pathology of the presence of Fasciula hepatica in the liver? Of course, they have some problem in the liver, and after that they have bile duct obstruction, carcinoma of bile duct, icters, and headache. And all of them show us that the patient is infected by Fasciula hepatica. The diagnosis of the infection is depending on fever, high eosinophily, observing operculated egg and fecal smear, which the size of egg is 130 to 150 micron length and 65 to 90 micron wide. And the next test is complement fixation test, which can tell us that the patient is infected by Fasciula hepatica. For prevention and treatment, what should we do? Treatment of domestic animals is one of the best ways for decreasing the infection in the environment, destroy the intermediate host or snails, cooking the vegetables, using the sanitary water, and after that, if the prevention doesn't work completely and we have the infection in human, we have to treat it. For treatment, dichlorphenol or ethionol 30 to 50 milligram for 1 kg every other day for 10 to 15 days. Dihydroamidine 1 milligram for 1 kilogram daily for 10 days, but injected IM or intramuscular.